And tonight we have a special talk from a local doctor here who we're going to welcome here shortly after I introduce you to her. She is Dr. Kelly Winnett. Dr. Kelly is an Arizona native who knew she wanted to change people's lives with the power of natural medicine after struggling with her health as a child. Her first naturopath corrected her, telling her if she wanted to heal people, she needed to go the naturopathic route, and that's what she did. With an emphasis in hormones, immunology, and longevity, she brings a unique approach to her patients' care. Here to present to us, please help me welcome Dr. Kelly Winnett.
All right. Is it on? We good to go? Everybody can hear me? Yeah. All right. So I hear we're interested in longevity, yes? That's a thing here. We have the hack. So we're going to go over the power of forgotten medicine, talking about the power of ozone and ultraviolet blood irradiation. So a little bit about me and the clinic that I come from. I work at Silver Tree Wellness Center. It is an office with only naturopathic doctors in it. We've got some nurses and some EMTs to help us out. And Dr. Jennifer Smith founded the clinic with a focus on bioregulatory medicine. Most people in America don't understand that term. It's something that they use really commonly in Europe, bioregulatory medicine. It's using homeopathic drainage and natural remedies. And it was a thing in Europe before Dave Asprey made biohacking cool in the States. So we were doing it first. I joined her team in 2021. I've been there ever since, running the back, seeing my own patients. And we've had ozone therapy this entire time. But in 2022, we brought on EBU. So that's what we're going to get into today. So a little bit more. Bioregulatory medicine encompasses every non-prescription therapeutic application. This can be sauna, cold application and hydrotherapy, ozone, PEMF, which stands for pulsed electromagnetic field therapy, different frequencies, whether it's sound frequencies or haptic feedback, things that distract the nervous system and convince your brain to get out of the monkey mind and come back into the body so you're not running from saber-toothed tigers every second of every day. That's not good for longevity, by the way. We also use heart rate variability testing and bioimpedance testing to measure the efficacy of some of these treatments on our patients. Bioimpedance testing is non-invasive. It uses galvanic skin response, and it's an awesome way to keep tabs on your health. So with that focus, let's go more into the therapies. Ultraviolet blood irradiation. Imagine if we could show all of your red blood cells to the sun. That's essentially what we're going to do. Our machines have 3 different light bulbs, UVA, B, and C. They all have different frequencies, and those frequencies penetrate through the cells. So I couldn't bring one today because we needed them all. But on the IV tubing, which everybody's seen an IV, it has a quartz cuvette. It is not glass because glass is thicker. And the quartz can carry the frequency of that light and expose it to the blood. So the blood gets stirred through this special magical crystal straw, and the properties of the UV light alone are a germicidal. So it's got tons of publishing behind it, and it became popular in the 30s when antibiotic resistance was coming to the forefront of medicine. So we already knew we were going to need this. It had a ton of studies. I'll let you guys read this while I ramble. But essentially, this really smart guy named Dr. Campbell in 1993 published a book essentially coining how Rockefeller medicine is going to suppress this because it actually works and we can cure really aggressive disease processes. Give you guys a second. I still see eyeballs going left and right. The reason whispering works is because it's a game to them. It takes them out of fight or flight. All right, so Dr. Campbell, really smart guy, and he said it right there, that it cures the incurable. So this is a list from a book. That book is written on the side if you're curious. It's called The Invisible Cure by Dr. Tom Lowe. And those were the studies from the 1930 to 1955 about the knot technique. The knot technique is very similar to what we use in ozone therapy, but it was only light. So they were curing these people of diseases with UV light alone, UV and heparin. So keep that nugget in the back of your head. Now we're gonna talk a little bit more about ozone. Ozone and EBU. So ozone is just an O3 molecule. We're breathing oxygen, that's an O2. When you add an additional oxygen group to that little friend cluster, it has a new charge, and that charge makes it incredibly reactive. So things like viruses or fungus can't exist anymore. They don't know how to handle that electrical potential. We do. We're electric beings. It charges us. It rejuvenates us. So for us, it is powerful and potent, and for anything else, not so much. So that's ozone. Ozone in itself can be delivered in multiple different ways. I'm gonna go through on the next screen talking about the different applications, but for the basics, when we're talking dosing, MAH is a little baby dose of ozone. It gives you anywhere from 3,000 to 8,000 micrograms of ozone. That's still gonna kick COVID for people. That's what we did. High dose O3 with UV. So now this is the first time we're gonna pair ozone with light in our clinic and in clinics across the nation. You don't use high dose ozone you don't use high dose light, that's the word, UV, with low dose ozone. You always combine them. So high dose ozone with UV gets you 70 to 87,000 micrograms of ozone. Pretty potent, that's gonna kick something in the butt. And EBU will deliver 150,000 micrograms of ozone to the system. So by far, it's the biggest dose we can give, and it is very well tolerated. We're gonna go through that in a little bit. Different routes to administer ozone. So this isn't just in the veins. It is toxic to the lungs. You will never speak to a medical professional who says, breathe this. You will give yourself some issues. It is always administered intravenous via insufflation, limb bagging. It's a very controlled delivery that is done by a trained professional. And yeah, when it says insufflation, that's just putting gas in that area. It is amazing for things like ulcerative colitis, recurrent BV, sinus insufflation. I've gotten rid of antibiotic-resistant infections in the sinuses with ozone. Limb bagging is for things like gangrenous limbs, diabetic ulcers that will not heal, and you put a bag of ozone trapping the oxygen molecules on the tissue, and it will regenerate the tissue. The health benefits, so we kind of touched on these, but we're gonna go through them even more in depth. Germicidal, everything from bacteria to viruses to fungus, you name it. If it is a tinier being than us, it really can't handle the ozone. Rheological, there's something called a rouleau effect, and it's how red blood cells move through the body. If we see the rouleau effect happening, it means the red blood cells are clumping together, and it's kind of like a traffic jam moving through your veins. That's not how we want blood to flow. You want a nice stream of energy and of nutrients being delivered and waste constantly being taken away. So if we have a rouleau effect happening in the blood where you're not getting that smooth movement, we've got a problem. Ozone, especially these high doses in EBU, will unclump that traffic jam and allow individual red blood cells to flow without impedance. That's huge when we're talking nutrients and waste removal and letting the body function optimally. It does have immune modulating effects. We don't say stimulating because you can safely give EBU to somebody with an autoimmune condition. This will not overstimulate them. This brings them into balance. Something we see often in our clinic with our complex patients is there is a Th1 and a Th2 balance that happens. Essentially, without getting too technical, the adaptive and the innate immune system sit on a seesaw, and that seesaw starts to go wonky. Ozone will help bring it back into balance. You start to have regulation of histamine effects, so these very allergic people, not so allergic anymore. That immune system's calming down. Analgesic effects. We're bringing oxygen to painful, inflamed areas. It's gonna help with pain. It's supporting detox in all organ systems and tissues. It's supporting inflammation reduction. Redox balancing is a fancy word for anti-rust. The reason we age is because we can't keep up with the rust in our cells, literally oxidizing cells. And it is this, another seesaw. There's a lot of seesaws in our body tonight. It's another seesaw of pro-oxidating and anti-oxidative effects. EBU will bring it into balance. Mitochondrial repair, because it has that extra charge, it can jump through cell membranes. So when we sit there and talk about our vitamins and our supplements, that's all fine and dandy if it can get in the cell. If your cells are rusty, if your cells are oxidized, if you have too much inflammation, how are you supposed to take up those nutrients? That's where frequency healing, that's where ozone, that's where all of these alternative therapies can come into play, because they can go through a cell wall way easier than a vitamin can. Looks for scavengers, all this other great stuff. We love it. These are some conditions that it can benefit. You kind of heard me talk about all of them. Fancy list. This is my very first search for ozone and infections. Clearly, it's very legible. All to say there are studies behind this. This isn't woo-woo. This isn't alternative. We have peer-reviewed studies saying that this is medicine. Why it's not in hospitals yet? I don't know. Don't ask me. I'm not in charge. So let's say you're like, yeah, I need this right now. How do you prepare? First, you have to get a good night's sleep. Be very well rested, please, and drink your water. The other critical thing about EBU is that you can't fast before you come in. When we do an EBU, and I'm going to show you what the procedure looks like here in a little bit, it will actually remove it removes the blood and puts it through a filtration. When it does that, it can drop your blood sugar and you become hypoglycemic. I really don't want you passing out when I've got 2 catheters in your arms and you're sitting there and I'm the only one in the room. Please don't do that to me. I gotta squirt some honey in your mouth. It's not fun. No alcohol, no intense activities. Please don't sauna and cold plunge. We know that they're great for longevity. I want your veins to be normal. I don't want them stressed and dilated. I don't want them cold and vasoconstricted. And consult with your doctor before you take any medications. Vitamin C, contraindicated, blood thinners, you gotta talk to a doctor. So what it looks like, and these are a smidge out of order. So I think we're starting over here with the bag, if I'm not mistaken. Okay, so you can see this filter is full of blood, and right back here, you can actually see the lights. It just looks like sunshine because it's the UVA, UVB, UVC, and it's coming right back here to the patient. This is the filter in the beginning, so you can see the blood's not all the way up there yet. This is where the blood is actually exposed to the ozone. So when this is running over the course of an hour to get that 150 micrograms of ozone, 1/3 of your blood is taken out and run through this filtration system. We can't do that with high dose. You would not be conscious. The benefits of a protocol like EBU is little bits come out and come back in. This is the same reason why this procedure works well for my chronically ill patients with long-haul COVID and mold exposure and Lyme. They can't handle big doses of ozone coming back into their body from the bag. So something like a high-dose ozone can cause a Herxheimer reaction or a Herx reaction. We don't get that with EBU. This is very well tolerated because it's small amounts of ozone coming into the body at a time. The body can adapt pretty quickly. And then lastly, you can see the red right here, that's where the blood's going back in, and the blue is where it's coming out. The only other thing I wanted to point out, if I'm in the way, tell me, this vein right here, do you see how that tube is actually dark and this one in the back is almost like a strawberry color? Yes, everybody see that? It's not a trick of the light. The blood that's coming out is darker and the blood that's going back in is brighter. Ozonated blood should look like a strawberry color. And I swear to you, I am not kidding. I can tell how sick somebody is by the color of their blood when it comes out. It is thick, it is dark, it's like molasses. My machine, when this little part right here, I hope everybody can see, I'm gonna sit down. When this part starts going and we're pumping blood up through the filter, this will actually work harder and it makes the machine jump. The machine has to work harder to pull blood, and we can see how well somebody is just by the quality of their blood. So then what happens? How do you recover? The entire procedure itself is about an hour and a half, depending on how easy your veins are, if we need heating pads, if you pass out, if we need honey, all that good stuff. No alcohol for 20, oops, wrong way. Sorry guys, wrong way. No alcohol for 24 hours. Lots and lots of water. We just pumped your body full of ozone. We need that ozone to move about the cabin freely. Water's gonna help. No vitamin C, it will actually create more of oxidative stress, and that's what we're trying to relieve. And chemotherapy has to be done 3 days away from EBOO, but it can be done in conjunction with EBOO. And so, now you're like, I really wanna do this, what do we need? The bare minimum we need from you, from your other providers, we need labs. A CBC is gonna tell us what white blood cell and red blood cell status. CMP is looking at kidney and liver. And I need a specialty lab called a G6PD. G6PD is an enzyme, and if you have a deficiency of this enzyme, this treatment is not gonna do well on your organs. I need to know those things ahead of time. These can all be cash paid labs, they are not specialty. This is very attainable for people. The only absolute contraindications for ozone therapy and EBOO is pregnancy and an allergy to heparin, the blood thinner. I have to take your blood out of your body. I will not do that if I can't prevent it from clotting. So those are the only two true contraindications. Everything else is at the discretion of physicians, AKA us. More safety stuff. So the International Scientific Committee of Ozone Therapy is the largest committee based in Europe, and they surveyed a bunch of physicians, I'm in the way, and essentially 1 out of 16,667 cases had complications, and none of them were due to ozone. They were all administrator error. It was done wrong, things were not sterile, the provider was at fault. So ozone in and of itself, incredibly safe, incredibly effective. If you're gonna get it from Joe Schmo, who's just like sitting in a Fry's parking lot like, hey, you want some ozone? Please don't, please run. You're in the wrong parking lot. Okay, very safe, very effective. So how do we get it? You have to have approval for this because it is an aggressive therapy. If you have a provider who is familiar with EBOO, tell them you want it and get a prescription. If I have their signature, their phone number, and your name and birthday on it, we're golden. If you don't have a provider who knows what EBOO is, they're behind on the times, get a new provider. In the meantime, come see me. We'll get you established as a patient, run through your history, make sure you're not on any medications that would be contraindicated. And let's say maybe you have lived in mold. Maybe you did get diagnosed with Lyme and your history is a little bit more complex. We walk through what that treatment plan would look like incorporating these therapies. Proof of labs, if you have them, great. Don't have them, we'll run them. And then the caveat here is depending on how healthy you are. Number 3 and number 4. Like I said, if you are not the healthiest and you've got a history, we'll talk about it. You might have to do an intro dose just so we see how do you tolerate EBOO, and that's gonna lead to the ultimate longevity. So how do we use this for longevity? The ideal protocol, once a week for 3 weeks in a row, minimum 3 times a year. Essentially, every change of the seasons, you need an oil change. It's that easy. When you take your car in, you should come get some too. Maybe that's not a good analogy. I drive way too much for that. But because you guys were so generous in inviting us here, the Silvertree team actually put together discounts for you guys. You can screenshot that page. Get ready, on the next screen there will be a QR code. I don't know, do they get copies of this PowerPoint? Awesome, so you'll have access to that information. So you can get individual sessions. I'm gonna tell you right now, that's not gonna do anything. If you're ready to invest in your health and in your longevity, you have to get a minimum of 3. You guys are walking around. I'm gonna take a wild guess that all of you are over the age of 15. I saw one tiny person running back there, but that's about it. That means we have decades of toxins and oxidative stress built up, and it's gonna take a little while to get that out. So packages are your best bet. And then, if this is something you're interested in, get your phone out. That QR code is actually gonna take you to our EMR system. If you fill out that information, that is, I'm in the way, that's gonna take you, you put in all your birthday, all of your Important information. It's HIPAA protected, and our team's gonna call you guys sometime next week, probably on Monday, and say, hey, I heard you want EBU. When can we get you in? Let's start. Are there any questions? Because I feel like I just rambled.
Thank you so much. That was great. That was a lot of information. We've heard a lot about EBU, but not in the detail that you just presented today. So
Awesome.
we'll go ahead and take
too
some
much.
questions. Also, for the people online, we already have a couple of questions. Does insurance cover this?
Insurance will cover the labs. I have yet to see it cover EBU. You can use an HSA or FSA.
Okay. How is the EBU machine cleaned between uses?
Anything that blood is exposed to is disposed of.
I love that answer. Quick to the point.
Yeah.
Okay, questions here? Anybody? Here, Sammy?
I have a question.
Ask away.
So there is not risk of overdose ozone?
So that's why the benefit of EBU comes into play. If I were to do it in that high dose capacity where blood is collected in the bag and I inject ozone in a bag and that whole thing drips back in your body, that's where people start to have adverse reactions. And it tends to be with the amount of blood that was removed. Has nothing to do with the ozone because we can handle that really well. You just got super oxygenated. It's more like they're gonna have reactions from losing too much blood. When we do it in EBU and it's a controlled amount outside of the body going through that circuit at a time, there's less reactions. So it has nothing to do with the ozone itself.
Okay. So what about the aspirin or medicine for immune system?
That would be a console. We're not gonna get into all those right now. We'd be here forever.
Okay.
Katie, you had a question?
What about like hyperbaric chamber with EBU? Can you do?
They pair
same time?
extremely well together. We generally say don't do them on the same day if you've never had it before, but they're gonna work very synergistically. So you would do your EBU and probably no HBOT before or 24 hours after. Let that ozone settle in, especially so you know what it feels like in your body, especially if you have a complex medical history and we're actually trying to remove toxic loads. And then after you know what it feels like, then you can probably shorten that duration. But hyperbaric works on driving. It's a passive, just like ozone. But ozone, you want the cells to have uptake first. Then we would do HBOT. But yeah, they're complementary.
Great. I also had a question while we get to Melinda. You spoke about the 3 once a week of, every 3 months for longevity. But what about people that are having, chronic conditions or pain or treatment? Is there the different?
Those protocols change.
They change.
I had a patient, I was doing EBU twice a week for 8 weeks.
Wow.
Yeah,
Okay.
yeah. So it just depends on what we're working on.
Okay.
Hi, thank you.
Yeah.
If ozone is detrimental to the lungs, how does it work to then treat sinusitis, you said?
Yeah, very
The
carefully
sinuses,
is the
because-
short story. You have to really trust your patient and understand that they're compliant. And what happens is I have them breathe in and I say, okay, breathe in even more until you feel like you're gonna burst. And then I plug their nose and squirt it in their nose and they have to hold their breath the whole time and then exhale when I tell them to. So this is not something for children. This is something for adults who can follow instructions. We're not using this for dementia patients that might accidentally huff it. And then if they do, they're gonna cough and it's gonna burn and they're gonna need some kind of soothing. We generally do teas in our office, like a marshmallow tea is a very demulcent. But yeah, as long as the patient can understand directions and the therapy is indicated, it's no problem. Yeah.
Hi, awesome. I have a question. And do you know about hemochromatosis? Like, what if the person has blood problems or anemia? Is that something that you suggest to do EBU? And have you heard about that helping sleep disorders?
Sleep apnea or like
No,
insomnia?
like restless legs, like sleep disorders.
So ask a couple really good questions in there. Hemochromatosis, anemia, any kind of iron deficiency, this is going to help. So when we go back on the slides, let's see, am I still on there?
No, they're not.
Oh, maybe.
Okay.
Oh,
Let me get them back here.
Yeah, okay. So when we come back here to this one, and we're talking about that rheologic effect and the mitochondrial repair, all of that is oxygen delivery. So let's say you're anemic and you don't have enough iron. Ozone and EBU is going to be beneficial because that's enhancing oxygen delivery instead of you just struggle busting over there by yourself, missing your iron or whatever it is. Hemochromatosis is falling under the inflammatory reduction because too much inflammation, we're going to help knock it down. You asked one more thing.
About the sleep disorders, if it helps, do you know if...
Restless leg I've seen with a bunch of other things. I wouldn't, EBU's not my first go for restless leg, but it would not hurt.
Okay, we have one question here.
Thank you. I don't think anyone in here has sickle cell anemia, but would that help with sickle cell anemia?
We're gonna say a very vague statement of at the discretion of your doctor because this is being recorded. Now, sickle cell anemia, as long as you're running the proper labs and it's being monitored, you can do things to help that. Depending on the type of sickle cell, may never be reversed. Does that make sense?
Well, because I mean, the clumping part is the part that
That's the rouleau effect that's different from sickle cell. Sickle cell is the shape, it's an anomaly of the red blood cell. The rouleau effect is more of you're trying to drive on the 101 at 5 o'clock and you're stuck in the traffic jam and that's what your red blood cells are doing.
Okay, thanks.
Yeah.
Okay, we have one more question here with Dean.
Couple quick questions.
Yeah.
Did I read that right on no blood thinners
For which part?
for EBU? No
For the
blood-
day of?
Okay, how about nattokinase?
Nattokinase is fine. And it's
that
not
fine?
no blood thinners. It's at the discretion of your doctor. And we have to look at the timing and the half-life of what you're on. Warfarin's gonna act incredibly different than Eliquis, and I have to use heparin in the bag. So that's how comfortable am I with math and with somebody's health.
So nattokinase, okay?
Nattokinase is totally fine.
Okay. What if somebody did EBU one time? You recommend 3 times, once a
It's
week?
gonna have beneficial effect, but the problem is you don't live in a bubble. So you're constantly exposed to toxins and inflammation and pesticides, and that one treatment probably helped you short term. You probably slept amazing, you probably had more energy, mental clarity, you name it, but eventually it's gonna get worn off. So,
Okay, thank you.
Okay, we have another question from online. Can you talk about the potential to introduce oxidative stress in the body?
can you clarify that EBU is introducing oxidative stress? Because it's not. It's alleviating the oxidative stress. That's why we have to be very specific about the therapies that we pair it with. So if somebody just got a high-dose vitamin C IV, I'm not gonna do EBU for 48 hours. It's not good to stack.
Okay, great job, by the way, great job. So on the vitamin C issue, so I'm assuming, of course, because the oxidative stress is also very important to watch your vitamin C level, not to overdo vitamin C for that purpose. I mean, some people say, well, you get a.
Are you
bug
talking
coming-
vitamin C in general or vitamin C with EBU?
I'm talking in general now, okay, not just connected to EBU, because you
Vitamin
mentioned it causes
C-
oxidative stress, so.
It
so-
can when it's paired with the electrons of ozone.
I see.
Vitamin C
Okay.
by itself is water soluble, and
Yeah,
I
water
do
soluble,
20
that's what I
gram
thought.
bags
Yeah.
on the regular for my sick patients.
Exactly, high dose can be good for you in certain
Exactly.
circumstances, okay. And then you mentioned about, I think it was Dean's question here, when you're, is another reason why you do 3 is because I also heard or read that it also has to do with the volume of blood, then you're able to circulate for those 3 times, is that correct?
Exactly. If you wanted to get crazy, you could go once a week for 4 weeks, once a
Yeah.
week for 5. I'm not gonna say no.
No.
It's how many hours are you gonna give up sitting in a chair and how good are your veins?
Right.
So like with my sick patients, and I say twice a week for 8 weeks, their veins get a little wrecked by the end. And sometimes you have to take a break, and we're giving them homeopathics to recover because the therapy is so effective, but their physiology can't handle it.
Understood.
But yes, that's in theory why we say once a week for 3 weeks, because it's getting a third of your blood
Yeah.
at the time. But let's be real, as soon as it's back in the body, it's mingling.
But like you said, when you do 1 treatment, you're not getting the benefit of 3, and does that have a lot to do with the volume of blood, then you're able to circulate with 3?
So
Or actually treat? Does that have to do with volume too? of your
that
blood?
more depends on the body burden, because if you, let's say you've got an acute virus going on, or you just recovered and there's some lingering inflammation. The EBU is going to go where the body dictates is the most severe. So if you've got these concomitant things and you want to do it for longevity, but you've got some joint inflammation that for some reason your body is prioritizing, it's going to go work on inflammation first. We can't tell it where to go. So that's why the subsequent therapies of seeing it frequently, those effects never really die off. Yes, the ozone's technically not in the blood, but doing it once a week gives your veins time to recover. It gives it time to circulate. It gives you time to observe your own biology and say, I felt this days 1 through 3. After day 5, I'm pretty normal. Then we know we could probably do it every 5 days if you wanted to.
Right. When you're inserting your needles for EBU, do you by any chance use ultrasound location to find the vein?
We have ultrasound location. We only use that on the very tiny veins.
The tiny vein, people that have, but that enables you to get those veins for people who have really tiny veins.
Exactly. Correct. So there is a catheter limit. We cannot use butterflies because of the volume of blood. Right. It is a pretty big catheter. Big, yeah. So we sit there and we put hot pads on you, and you've got the tourniquet on. And my nurse that runs these, if I'm not doing them, it's my nurse Megan, and Megan is the only person I trust to stick myself with. She's phenomenal, and most of the time we don't need an ultrasound, especially if you're in a group like this and you're focused on longevity and you're not doing the things that were on that list that are going to contribute to bad veins. I bet I could find some, because they don't have to be right here. I can hit a handcuff vein. I can get, as long as it's a juicy vein, we're good.
Is EBU, the treatment of EBU, one of your specialties? Are you the one that usually does it, or do you have several?
Depends on the week.
Depends on the week.
I'm either busy doing consults or busy doing procedures.
I see. So you have a specialist that does that along with you? Okay.
Yes.
Okay,
Can you speak to other treatments that you do besides EBU at your practice?
Which ones do we want to know about?
That's a long list.
All right, I'll tell you about my new favorite one.
I've been there, the
So
clinic.
like if we were to come in and do the EBU, what else will be our disposal within your practice?
So the number one off the bat, as long as you don't have a pacemaker or metal in your body, we'll recommend the med bed. So it's called the Immortal. Currently, we have the only one in Arizona.
It's Immortal.
It's amazing.
Amazing.
It combines 5 therapies in one. So the entire bed generates a pulsed electromagnetic field, which was originally used for racehorses to decrease inflammation. Your cells all operate on a voltage gate that open and close with a negative charge. When we put that negative charge in a field from a magnet, your cells start to synchronize, and they're taking up nutrients and they're getting rid of waste like the Rockettes. And now that you're synchronized and you're taking up your oxygen and you're getting rid of your waste effectively, you can heal. That's just one therapy. It has red light in the 660 to 850 nanometer. It has sound frequency. It has light frequency. What did I miss? Hydrogen gas. You are breathing hydrogen gas. You're breathing an electron. Hydrogen gas is not EBU. You can breathe it in, and it has anti-cancer properties. It has, I love hydrogen. Let's not get on that soapbox right now.
It's a phenomenal treatment, yeah. That's the one I did.
And then you pick your meditation, and you say, do I need to calm down? Do I need to be creative? Do I need to completely reset? And it plays different meditations, and the bed vibrates at different frequencies. So you're getting a 5-in-1. Immortal would be the go-to. Any lymph therapy.
You're one of the few clinics probably in this right now, I think, in the country that has that, aren't you?
We're the only one
comes
in
from
Arizona.
Germany. Pardon me?
We're the only one in Arizona right now.
Oh, wow.
Yeah. I heard they might be getting another one, but we're the only one at the moment.
Okay.
Any lymph therapy is going to be fine. Lymph is your body's waste management, for a good analogy at the moment. And if your trash cans cannot take out the trash effectively, we're going to have issues. So any sort of our lymph therapies that will move the immune system, totally fine.
And you also do colonics, they're great.
We have colon hydrotherapy. We have an infrared sauna. We have, oh my gosh. We have a single pulse electromagnetic field bed. So if you don't want to sit in the Immortal because you don't want to be in Star Trek, the bed can be super targeted. So I actually had a guy with frozen shoulder, and I put the paddles on his shoulder, and the magnets alone allowed him range of movement. So we do a ton.
That's a good analogy that on the Immortal, that it's like a Star Trek ship.
That's as close
what
as you
feel
get.
like.
The
It's
med
like from
bed.
outer space. You lay it, that's what it even looks like, you know? I'm
Med
going,
bed
whoa,
incarnate.
I have to get in that. It might take off, you know? So,
And it's open. So when we say bed, it's not like you get closed in and you're claustrophobic.
it's
You lay
open.
on the bed, and then once you hit go, the top lowers down, and you can still roll out if you wanted to, but it's amazing.
yeah, it's amazing, yeah. Okay.
Oh, do we have time?
You had different sessions. I did a 40
Oh,
minutes?
they're anywhere from 20 minutes to 45.
Depends on what kind of selection, what you pick to do, but mine was 40 minutes, I think. The 40-minute one, do you remember what that was?
That was the deep restore.
Deep restore, yeah.
Okay, awesome. Okay, so that's it for our time, but thank you so much,
You're
Dr.
so
Kelly.
welcome.
So I appreciate you.
Yeah, thanks for having me.
Thank you.